If you're dealing with cold feet, heavy legs, or poor circulation, you've probably heard that certain vitamins can fix it. And you're right, there are 3 specific vitamins that affect your blood vessels in powerful ways. But here's what most people don't know. Brand new research from 2024 just turned everything upside down. One of these vitamins that's been promoted for decades might actually increase your risk of heart disease. The second one has surprising limitations that nobody talks about. And the third one actually works, but only if you understand exactly how and when to use it. Today, I'm giving you the complete truth. No marketing hype, no false promises, just what the science actually shows about these 3 vitamins and your circulation, because you deserve to know what really works and what could potentially harm you. By the end of this video, you'll know exactly which vitamins help, which doses are safe, and what the newest research says you should actually be doing for better leg circulation. Let's start with understanding what's really happening in your life. When your legs feel heavy, your feet are cold, or you can't walk as far as you used to, something specific is happening inside your blood vessel. Your arteries are like highways, carrying oxygen-rich blood from your heart down to your legs and feet. When circulation is poor, 3 main problems develop. First, the arteries narrow. This is called atherosclerosis. Plaque builds up on the artery walls, making the passage smaller. Imagine a 4-lane highway turning into a 2-lane road. Same amount of traffic, but everything slows down. Second, the vessel walls become stiff. Healthy arteries are flexible. They expand and contract with each heart, but over time, calcium deposits and other changes make them rigid, like a garden hose that's been left in the sun too long. When vessels can't flex properly, blood flow becomes sluggish. Third, the endothelium stops working right. The endothelium is the thin layer of cells lining your blood vessel. These cells produce a crucial molecule called nitric oxide, which tells your vessels to relax and stay open. When the endothelium is damaged, nitric oxide production drops and your vessels stay constricted. Here's the important part. Over 10 million Americans deal with peripheral artery disease. That's the medical term for poor circulation in the legs. This isn't just about cold feet. When blood flow drops significantly, it limits how far you can walk, affects your independence, and increases your risk for serious cardiovascular problems. Now, the supplement industry has jumped on this problem with countless products promising to fix your circulation overnight. But here's what you need to know. The most comprehensive medical guidelines published in 2024 by the American College of Cardiology and American Heart Association analyzed all the evidence for treating peripheral artery disease. And when it comes to supplements, the recommendations might surprise you. The guidelines don't say supplements are useless. They say we need to be smart about which ones we use, understand the actual evidence, and know the risks. So let's talk about the 3 vitamins that keep coming up for circulation. And I'm going to tell you exactly what the research shows, the good, the bad, and the surprising. Let's start with niacin, also called vitamin B3. For decades, people have promoted high-dose niacin for circulation, and there's a reason. It does something visible and immediate. When you take niacin, especially the flushing form, your skin turns red and feels warm. This is vasodilation. Your blood vessels are opening up. You can feel it working. This flush happens because niacin triggers the release of prostaglandins, signaling molecules that tell your blood vessel walls to relax and stay open. So for years, the logic was if niacin opens up vessels, it must help circulation, and that made sense. But in February 2024, everything changed. Researchers at Cleveland Clinic published a major study in Nature Medicine, one of the most prestigious medical journals in the world. They followed over 3,000 people and discovered something alarming. Excess niacin might actually increase your risk of heart attack and stroke. Here's what they found. When your body breaks down niacin, it creates a byproduct called 4-PY. People with high levels of this 4-PY compound had 1.6 to 2 times higher risk of heart attack, stroke, and other major cardiovascular events. The researchers went further. They discovered that 4-PY directly triggers inflammation in your blood vessel. It's not just a correlation. They showed the actual mechanism. This compound activates inflammatory pathways that damage the vessel walls, the exact opposite of what you want for healthy circulation. Now, here's the kicker. 1 in 4 people in the study already had elevated 4-PY levels just from fortified foods. We're talking about breakfast cereals, energy bars, enriched bread, foods that have niacin added to prevent deficiency. Many people are already getting more niacin than their body handles well without taking a single supplement. This explains something that puzzled researchers for years. Previous large trials testing high-dose niacin alongside statins found worse outcomes, more cardiovascular events, not fewer. Studies like AIM High and HPS2 Thrive showed that adding niacin to statin therapy didn't help and possibly caused harm. At the time, researchers couldn't explain why. The 2024 study gives us the answer, the 4-PY pathway. So what does this mean for you? If you're thinking about taking niacin for circulation, you need to understand 3 things. First, yes, niacin does cause immediate vasodilation. You will feel the flush. Your vessels do open up temporarily. That part is real. Second, we now have strong evidence that chronic high-dose niacin supplementation, the doses people promote for circulation, typically 250 to 500 milligrams daily, may increase long-term cardiovascular risk through this inflammatory pathway. And third, the 2024 guidelines for treating peripheral artery disease do not recommend niacin supplementation. The evidence just isn't there that the benefits outweigh the risks. Now, this doesn't mean niacin is poison. Your body needs some niacin. It's an essential vitamin. The recommended daily amount is about 16 milligrams for men and 14 milligrams for women. You get this easily from food: meat, fish, nuts, legumes, and yes, fortified foods. The problem is high-dose supplementation, especially without medical supervision. If your doctor has prescribed high-dose niacin for a specific reason, like managing certain cholesterol patterns, that's a different conversation. You're being monitored. Your doctor is weighing specific risks and benefits for your situation. But for self-supplementation to improve leg circulation, based on the 2024 evidence, I cannot recommend it. The potential risks appear to outweigh the temporary vasodilation benefit. This is hard news if you've been taking niacin or were planning to start, but you deserve to know what the latest science shows. Your safety matters more than sticking to old recommendations. So let's move to the second vitamin, one with a very different evidence picture. Vitamin K2 is fascinating because the theory behind it is elegant and makes perfect biological sense. Here's the idea. Calcium belongs in your bones, not in your blood vessel. When calcium deposits build up in your artery walls, a process called arterial calcification, your vessels become stiff and rigid. Blood flow drops, circulation suffers. Vitamin K2 activates a protein called MGP. Think of MGP as a calcium traffic cop. When it's activated by K2, MGP binds to calcium that's accumulated in your artery walls and helps remove it, redirecting that calcium back to your bones where it belongs. Theoretically, this should restore flexibility to stiffened arteries and improve circulation. The mechanism makes sense. The question is, does it actually work in real people? And here's where the evidence gets complicated. A well-designed 2015 study followed healthy postmenopausal women who took 180 micrograms of vitamin K2 MK7 daily for 3 years. The results showed improved arterial stiffness compared to placebo. That's promising. A 2023 study in dialysis patients used 375 micrograms of K2 daily. The interesting finding? It showed benefit only in diabetic patients. Non-diabetic patients saw no improvement in arterial calcification. But then we have studies showing no effect. The K4 Kidneys trial gave people 400 micrograms of vitamin K2 daily for 12 months and found no difference in arterial stiffness. A systematic review looking at multiple studies found mixed results, some positive, some neutral, some showing no effect. So what's going on? The pattern suggests K2 might help specific groups of people: postmenopausal women with bone loss, dialysis patients with severe calcification, people with diabetes. But for the general population with poor leg circulation, the evidence isn't strong. This is what we call uncertain evidence. It's not that K2 is dangerous, it's quite safe at these doses. It's that we don't have clear proof it works for most people dealing with circulation problems. Now, vitamin K2 also comes with an important safety consideration. K2 is involved in blood clotting pathways. If you're taking blood thinning medications like warfarin, you absolutely must talk to your doctor before taking K2. It can interfere with how your medication works, potentially increasing your risk of blood clots or bleeding depending on the dose and timing. So where does this leave you with K2? If you want to try it, here's what makes sense. Based on the evidence, choose the MK7 form. That's the one used in most studies. The doses that showed benefit ranged from 100 to 180 micrograms daily. Take it with a meal containing some fat, since K2 is fat soluble, but go in with realistic expectation. You're not trying a supplement with overwhelming evidence. You're trying something that might help, particularly if you're postmenopausal, have diabetes, or have confirmed arterial calcification. And if you don't see improvement after 3 to 6 months, it's probably not working for you. That's okay. Not every intervention works for every person. The key is being informed about what the evidence actually shows, not what marketing materials claim. Now, let's talk about the third vitamin, the one with the strongest scientific support. Here's where we finally get to good news. Vitamin C actually has solid research behind it for improving improving blood vessel function. But before you rush out to buy massive doses, let me explain exactly how it works, who it helps, and what realistic expectations look like. Your blood vessels are lined with a thin layer of cells called the endothelium. These cells have one crucial job: producing nitric oxide. Nitric oxide is your body's most powerful natural vasodilator. It tells your blood vessel walls to relax and open up. Here's the problem. Nitric oxide is fragile. It's constantly being broken down by free radicals, unstable molecules that damage tissues throughout your body. When free radicals destroy nitric oxide faster than your endothelium can produce it, your vessels stay constricted. This is where vitamin C comes in. Vitamin C protects nitric oxide from oxidative breakdown. It also helps maintain another crucial molecule called BH4, which is essential for your body to produce nitric oxide in the first place. Think of vitamin C as both a bodyguard protecting nitric oxide and a factory worker helping to produce more of it. The research supports this mechanism. A systematic review and meta-analysis published in 2014 analyzed multiple studies and found that vitamin C supplementation improved endothelial function, the ability of blood vessels to dilate properly. But here's the critical nuance that most people miss. The beneficial effects were seen primarily in people who already had cardiovascular disease or risk factors. In healthy people with normal circulation, vitamin C supplementation showed minimal effect. This makes sense when you think about it. If your endothelium is healthy and producing plenty of nitric oxide, adding more vitamin C doesn't do much. But if your endothelium is damaged from diabetes, high blood pressure, smoking, high cholesterol, or existing circulation problems, vitamin C's protective effect becomes significant. So if you're dealing with poor leg circulation, there's good reason to think vitamin C might help. But we need to talk about doses. The studies showing benefit use doses greater than 500 milligrams per day. The standard recommended intake is only about 90 milligrams for men and 75 milligrams for women, enough to prevent scurvy, but not enough to provide the vascular protective effects we're talking about. For improving endothelial function, the effective range appears to be 500 to 1,000 milligrams daily, sometimes split into 2 doses. Now, high-dose vitamin C can cause digestive upset in some people. If you take 1,000 milligrams of regular ascorbic acid on an empty stomach, you might experience stomach discomfort or loose stools. The solution is choosing the right form. Buffered vitamin C is mixed with minerals like calcium or magnesium, making it gentler on your stomach. Liposomal vitamin C is encapsulated in tiny fat bubbles, which improves absorption and further reduces digestive issues. There's one more detail about timing that's worth considering. Some people find that taking vitamin C later in the day affects their sleep. Not everyone, but it happens often enough to mention. If you're sensitive to this, take your full dose in the morning or split it between morning and early afternoon. Vitamin C is water soluble, so your body eliminates excess amounts through urine. This means you're not at risk of dangerous buildup like you might be with fat-soluble vitamin. The main side effect of too much is digestive discomfort, which tells you to reduce your dose. So here's the practical takeaway for vitamin C. If you have poor circulation, taking 500 to 1,000 milligrams daily of a buffered or liposomal form is supported by research and generally safe. It protects the nitric oxide your body produces, helping your vessels stay relaxed and open. Is it a cure? No. Will it dramatically reverse years of arterial disease? Also no. But can it meaningfully improve endothelial function and support better circulation? The evidence says yes, especially if you already have cardiovascular risk factor. This is what evidence-based supplementation looks like: understanding the mechanism, knowing who benefits, using effective doses, and having realistic expectations. Now let's talk about what actually has the strongest evidence for improving leg circulation. Here's what most people don't want to hear. The single most effective treatment for poor leg circulation isn't a supplement, it's exercise. I know that sounds counterintuitive. Your legs hurt when you walk. The last thing you want to do is walk more, but the evidence is overwhelming. Supervised exercise therapy, where you walk to the point of discomfort, rest, and repeat, is the gold standard treatment for peripheral artery disease. Multiple large studies show it dramatically improves walking distance, reduces symptoms, and enhances quality of life. Here's why it works. When you exercise, your body responds to the increased demand for blood by growing new small blood vessels around the blockages. This is called collateral circulation, nature's bypass surgery. These new vessels provide alternative alternative routes for blood to reach your legs. Exercise also improves endothelial function, helps your muscles use oxygen more efficiently, and reduces inflammation, all of which contribute to better circulation. The most effective programs are supervised, meaning a physical therapist or trained professional guides your sessions. But even community-based walking programs with coaching show significant improvements. You don't necessarily need an expensive medical program. You need consistency and the right approach. The protocol is straightforward. Walk until you feel discomfort in your legs, rest until it goes away, then walk again. Repeat this for 30 to 45 minutes, 3 to 5 times per week. Over weeks and months, the distance you can walk before discomfort increases significantly. Now, exercise isn't the only evidence-based treatment. The 2024 guidelines also strongly recommend managing cardiovascular risk factors, controlling blood pressure, managing cholesterol with statins when appropriate, controlling your blood sugar if you have diabetes, and absolutely quitting smoking if you smoke. These aren't optional extras. They're fundamental to protecting your blood vessels and improving circulation. If you have diabetes, controlling your blood sugar protects the endothelium from damage. If you have high blood pressure, bringing it down reduces the stress on your artery walls. If your cholesterol is high, statins don't just lower numbers, they stabilize plaque and reduce inflammation in your vessels. Smoking is particularly destructive. Every cigarette damages your endothelium, reduces nitric oxide production, and accelerates atherosclerosis. If you're dealing with poor leg circulation and you smoke, quitting will do more for your legs than any supplement ever could. For some people, medication becomes necessary. Antiplatelet drugs like aspirin or clopidogrel help prevent blood clots. Xylostazol is a medication specifically approved for intermittent claudication. That's the cramping pain in your legs when you walk. It works by dilating blood vessels and preventing platelet aggregation. In severe cases where blockages significantly limit blood flow, procedures like angioplasty or bypass surgery might be necessary. These are real medical interventions for real arterial disease. The point is, poor circulation is a medical condition with evidence-based treatments. Supplements play a supporting role at best. They're not the primary solution. So where do the 3 vitamins we discussed fit into this picture? Vitamin C at 500 to 1,000 milligrams daily has good evidence for supporting endothelial function. It's safe, it's affordable, and it can be part of a comprehensive approach. Vitamin K2 has uncertain evidence. It might help specific people, but we don't have strong proof it works for general circulation problems. If you want to try it at 100 to 180 micrograms daily, understand you're making an informed gamble, not following clear evidence. And niacin, based on the 2024 research showing increased cardiovascular risk with excess intake, I cannot recommend high-dose niacin supplementation for circulation. The potential harms appear to outweigh the temporary vasodilation benefits. Let's bring this all together with what you actually need to know. If you're dealing with poor leg circulation, here's your evidence-based action plan. First, see your doctor. Get a proper diagnosis. Poor circulation can range from mild to severe, and severe cases require medical treatment, not just supplements. Your doctor can assess your circulation, identify risk factors, and create a treatment plan. Second, start an exercise program. Walking therapy is the single most effective non-surgical treatment. If supervised programs are available in your area, consider them. If not, start a consistent walking routine, gradually increasing duration and intensity. Third, manage your cardiovascular risk factors aggressively. Control your blood pressure. Manage your cholesterol. If you have diabetes, optimize your blood sugar. And if you smoke, make quitting your top priority. Fourth, consider vitamin C supplementation. Take 500 to 1,000 milligrams of buffered or liposomal vitamin C daily. This has solid evidence for improving endothelial function, especially in people with cardiovascular risk factors. It's safe, it's affordable, and may provide meaningful benefit. Fifth, if you want to try vitamin K2, go in with realistic expectations. Use 100 to 180 micrograms of the MK7 form daily. Give it 3 to 6 months. If you don't notice improvement, it's probably not helping you. And absolutely talk to your doctor first if you're on blood thinners. Sixth, be very cautious with niacin. The 2024 research raises serious concerns about high-dose supplementation increasing cardiovascular risk. If you're currently taking high-dose niacin, talk to your doctor about whether you should continue. Don't start taking it without medical supervision. Here's the truth that the supplement industry doesn't want you to hear. There is no magic pill for circulation. Your blood vessels are complex organs that respond to comprehensive care. Exercise,
exercise, nutrition, medication when needed, and lifestyle changes. Supplements can play a supporting role. Vitamin C has good evidence, K2 has uncertain evidence, and niacin has concerning new safety data. But the foundation of healthy circulation is movement, cardiovascular risk management, and proper medical care. You deserve honest information. You deserve to know what actually works and what's just marketing hype. And you deserve to make informed decisions about your health based on the best available evidence. Poor circulation is manageable. It's improvable, but it requires the right approach, not false promises and expensive supplements that don't deliver. Take this information, talk to your doctor, and build a real evidence-based plan for better circulation. If you found this helpful, subscribe to the channel for more honest, science-backed health information, and leave a comment letting me know what circulation challenges you're dealing with. I read every comment and use them to guide future videos. Thanks for watching, and I will see you in the next video.